The Government are way behind many of the targets set on delivering sláinte care, and they are failing in the delivery of universal health care and are not making any significant advancement on affordability. Now, medical card eligibility, which my colleague has already mentioned, it hasn't been reviewed in 2 decades, and for the majority of people, the thresholds are not increased in line with inflation and rising wages. In fact, the thresholds are so low that many people, depending on social protection, don't qualify. Now, I know they will be given the medical card if they're dependent on social protection, but they are actually their income on that level is that low that the threshold actually doesn't apply. And I do want to say and praise the people working in the section that deal with people who are applying for discretionary medical cards, because they are actually very accommodating and helpful and take into account all the circumstances. But it should be available to a lot more people. The thresholds need to be reviewed and increased. The Government also announced plans in 2020 to expand free GP care for children up to including 12. So I think it's since been legislated for under 8s, under 10s and under 12s, but so far only funded for children under 8. So that's something that needs to be addressed without delay. The amount a person has to pay on the drugs payment scheme stands at €80. It was 53 in 2001. It needs again to be reduced. There are a lot of costs and people shouldn't be out that much money in medication on a monthly basis. Automatic entitlement to a GP visit card for people on the median income should be applied, as the uptake has been very poor. Accessibility and not just affordability is central to universal health care, and more medical card holders are struggling to find a dentist or a GP and making this entitlement worthless. I deal with constituents on a regular basis who, when the GP retires, they have no GP to go to, or if they move home they can't access a GP service and remain travelling maybe an hour or more to actually visit a GP. In relation to the dentist, again I am encountering people on a regular basis who cannot find a dentist who will accept medical card holders. And I actually engaged with a constituent this week who had a cancer diagnosis and underwent chemotherapy, and thankfully is in remission and doing well. But the chemotherapy has affected her teeth very badly, and she has actually maximised the treatment available to her under the medical card. So I'm just wondering, Minister, if it was something I can put to you in writing, if some discretion can be given to people who have undergone chemotherapy which has affected their teeth very badly, and that they would have more access to treatment under the medical card than is currently available. Hospital and community capacity and workforce planning has not occurred. The Minister announced 1,500 hospital beds several times. They're not funded. As a result, hospitals continue to be overcrowded, and the car parking charges have not been capped or removed, despite promises to do so by the Government. And approximately 50% of the population continues to rely on insurance. I know in your opening speech you mentioned mental health and improvements that have happened there, but I am currently engaging with families who are having great difficulty accessing help, whether that's through the CAMHS teams. There's ongoing problems there. There's also a fall off them from when someone is discharged from CAMHS entering the adult mental health services. I know there's supposed to be more joined up thinking in that area, but it's still not happening on the ground. There has to be cooperation. I have one young man of 19 currently who has attempted suicide twice. He did receive significant help with the CAMHS team and with underage services, but has received practically nothing, even though he was promised a support plan. It hasn't materialised, and unfortunately attempted suicide and is in a psychiatric unit again. He is threatened with discharge, but he doesn't feel he's got any help, and he doesn't feel any different from when he entered there. So there are serious issues. We need community-based supports. Hospital care, inpatient care isn't the answer for everyone but we need robust community supports, and he didn't receive them. If he had, he might not be in hospital again, being threatened with discharge. And his parents and his family are so worried. He is worried himself that he is going to end up, and he doesn't want to die, but that's where he's headed if he doesn't get the help that he needs. Sinn Féin has a health plan to deliver universal health care, and in our alternative budget for 2024 we propose an expansion of 400,000 medical cards, to cut the drug payment scheme to €50 and to reduce CAP and work to remove car parking charges altogether. So we would deliver a transparent framework of income-based entitlements that sets out the path to universal coverage. And we would reduce the need for private health insurance by investing in the public system, including the 3,000 hospital and community beds that are needed to make hospitals accessible. I mean, I received word from a hospital just last week about a lady who's waiting for an appointment for extreme pain in her knee, and they said, oh yeah, we've received the referral, she's on the urgent list, she'll be seen in 8 months. I mean, 8 months is not an urgent list. I mean, again, that is something that needs to be dealt with immediately. If Sinn Féin were government, we will bring accountability for workforce planning to government level to tackle shortages of GPs and dentists and expand multidisciplinary primary care teams, essential components for improving access and providing capacity for universal health care. And we would work north and south to plan and deliver accessible, affordable health care on an all-island basis, and leverage the all-island population to deliver specialist services and end the need for outsourcing abroad and prepare for an all-island public health service. Cathaoirleach, the government are way behind many of the targets set on delivering Sláinte care, and we need a new government with fresh thinking to ignite the process of delivering Sláinte care.